The great approach to rating certainty of evidence and moving from evidence to recommendations has become the worldwide standard for looking at whether or not you have trustworthy evidence or the extent to which you have trustworthy evidence and deciding on recommendations that are going to help clinicians and patients. The GRADE approach has been spectacularly successful, but has got too complicated. So I'm going to describe the core GRADE approach, the essentials of GRADE, which we have just summarized in 7 papers in the British Medical Journal. The core GRADE approach for any clinical problem starts with defining the patients, the interventions, the comparators, and the outcomes. And what it focuses on is outcomes that are important to patients. Having defined the PICO, one looks for the highest quality or certainty evidence available to address your PICO. And you do what's called a systematic review. What makes a systematic review systematic is, first of all, this careful definition of the PICO, a comprehensive search for the evidence, assessment of the risk of bias in the studies that you find, and then conducting a meta-analysis which gives you the best estimate of effect for each of the patient-important outcomes. And then we go to the guideline panel, and the guideline panel has a broad representation with research experts, but also clinical experts who spend their lives taking care of patients. Patient partners participate, and methodologists participate in this. And the guideline panel then considers the evidence, and the guideline panel now has the responsibility of looking at that evidence and moving to a recommendation. And in the GRADE approach, they'll make one of two recommendations. They will make a recommendation for the intervention, or they will make a recommendation against the intervention. And then they will decide on the strength of the recommendation. Upsides clearly outweigh the downsides. They're going to make a strong recommendation. A close balance between the upsides and the downsides, or a lot of uncertainty, they're going to make what we call a conditional or weak recommendation, which acknowledges that they may be recommending for or against, but there's going to be some patients who, because of difference in values and preferences, might prefer the not recommended intervention. And that brings us to what the panel is considering when they decide on for or against, and they decide on a strong or weaker conditional recommendation. And they are considering the benefits, harms, and burdens of the intervention and the comparator. They're considering the certainty of the evidence, and they're considering values and preferences. That are the key things from the individual patient perspective. The summary of the core GRADE approach for the practitioners, for the systematic reviewers, and the guideline developers appearing in 7 papers in the British Medical Journal. And so from the point of view of the clinicians and the public, that's, we now have, you can rest easy that people who are using the GRADE approach now have one-stop shopping to find out the essentials of GRADE to produce the optimal recommendations that you as patients or clinicians can use to guide your clinical care.